Mr. President, none of these senators have read the bill. I have the floor, Mr. President. The bill's 142 pages long compared to the 2,700-page long Obamacare bill. They can read the bill. If they have objections to the provisions, we can debate them, but what they're talking about is a bill that does not exist, which they have not read. I object.
Objection is heard.
Mr. President.
Thank you.
Minority Leader.
Would my dear colleague from Texas yield to a question?
Senator from Texas does not have the floor. You have the floor.
I would like to just then tell my friend from Texas, this is the bill. It was posted online a half hour before we came online. And I'd ask a page to come over and bring it to my dear friend and ask him if this is the bill, which we have read.
Mr. President, all senators have a copy of this discussion draft bill. It is a discussion draft which will be open to an amendment process with unlimited amendments that could be offered by both sides following before which we'll have a fulsome debate. Our colleagues here are complaining about secrecy that doesn't exist. This bill's online. The American people can read it. You can read it. And I would suggest that they do read it before they start criticizing it.
Ask my friend from Texas to yield for another question.
I will.
Will we get more than 2 minutes to debate each amendment we ask for? Or will we be under reconciliation process where we have simply 10 hours of debate and then every amendment only gets 2 minutes? And does he consider that 2 minutes, if that's the case, a full and fair debate on each amendment?
Mr. President, I would say in response to my friend from New York, the fact that we are having to conduct this under the reconciliation rules is a result of their refusal to participate in the process, thus necessitating Republicans doing this under budget reconciliation rules. If they would do this in a true bipartisan way, where we could get 60 votes to get on the bill and open it to amendment process, we could have a better bill. But given the refusal of our Democratic colleagues to participate in the process, this is the only way we can come to the rescue of the people who are being hurt by the meltdown of Obamacare today.
Mr. President.
Just to clarify, did the senator from Texas object to the senator from Washington?
I do object.
Objection is heard.
Mr. President,
Senator from Washington.
Mr. President, I heard the objection. I just have to say, what the exchange we just heard is exactly what we've been objecting to. We were told that the bill would be online at 9:30 this morning. It was online at 11 o'clock. I have a copy of it. But we're hearing from the other side now that this isn't the bill. This is a discussion draft. We aren't going to see the bill. We won't see the real bill, apparently, until next week, even though we were told we'd see it this morning. This has been the problem we've had since this discussion started. We started in January with the process that cut us out of this under reconciliation. 13 men in a private room wrote this, quote, discussion draft that's not a bill that we're supposed to now look at and decide whether or not we like it in the American public. A discussion draft, a bill, even the other side doesn't know what we have. That's what we're objecting to. We're asking that the American people who have a right to know what is going to impact every one of their lives, every one of their families, every one of their communities, every one of their businesses have more than a discussion draft, more than 10 hours of debate, time to look at it and know how we're even going to do an amendment process next week. This is deplorable.
Senator, yield for a question.
Majority.
Yield for a question.
Happy to.
Mr. President, I'd ask the senator from Washington if she's aware of the fact that under the budget reconciliation process, there will be an unlimited number of amendments that could be offered by either side to the bill that's ultimately filed.
Oh, Mr. President, I am well aware of that, and I will remind our colleagues and everybody in this country, what will happen is that there will be 10 hours of debate where we hopefully have more than a discussion draft that we will be allowed to offer amendments on, and there will be no debate on those amendments. No one will know what it is. It'll be a chaotic process on this floor. The American public won't know. We'll be able to tell them days later after this gets undone. That's not an amendment process. That is not what we went through when we passed the Affordable Care Act. The American public deserves better.
Mr. President.
Minority Leader.
I'd ask my colleague a question. What would be wrong with 1 hour of debate on every amendment to this bill? What is the objection to that, since the majority is proposing no debate on amendments and then saying it's an open process? What is wrong with 1 hour of debate on every amendment offered to this bill?
Mr. President.
Majority Whip.
Mr. President, I'd say in response to my friend, the minority leader, that it is as a result of their refusal to participate in the usual process of passing legislation through the regular order.
Senator will be in order.
That we have to resort to the budget reconciliation process. It has a set of statutory provisions and rules. There will be a fulsome debate. There's already been a debate on a bill that you haven't read. And I suggest you take the time to read it, and then we can talk about the details. But this bill, 142 pages compared to 2,700 pages in Obamacare, it doesn't take that long to read. This is a start. This is not the finish. And this is called the normal legislative process. And I suggest colleagues, rather than criticize a bill that they haven't read, they read it, and then let's have a credible debate.
Democratic leader.
I would ask my friend, the majority whip from Texas, a series of questions. What was the date that reconciliation was added to the budget resolution, which said we didn't need any Democratic votes? Was it May? Was it April? Was it March? Or was it the very beginning of this session? I'd ask him another question. Where were the meetings held to discuss this bill, and were any Democrats invited? I'd ask him another question. Why did the majority leader not accept our offer to go into the old Senate chamber, 100 senators, no press, no anything else, and debate the bill? And how can my good friend, and he is a good friend, we're on the bikes in the morning together, my good friend from Texas, say that there was a bipartisan process when at the outset, our Republican colleagues said the only thing we'll debate is repeal and then replace. There was no discussion of whether repeal was the right thing to do or the wrong thing to do. And now, overwhelmingly, the American people prefer fixing Obamacare, which we offered to do, than repeal and replace. And it's no wonder, I would say to my colleague, as he answers these questions, that this bill is being brought in the dark of night. It is because my colleagues on the other side of the aisle are ashamed of the bill, because believe you me, Mr. President, if they liked this bill, they'd have brass bands down every main street in America talking about it. But they're trying to sneak it through because mainly their goal is a tax cut for the rich. So I'd ask my colleague to answer those three questions, and then he can respond to my rhetoric.
Mr. President, I'm really taken aback by the characterization of the minority leader here. The minority has made it clear that you don't want to participate in the process of rescuing the American people from the failures of Obamacare.
Senate will be in order.
It's been made clear to us that you don't want to participate in the process, and you are turning a blind eye to the people, the millions of people who are being hurt today by outrageous premiums, deductibles they can't afford, and a loss of choices because insurance companies have pulled out of the individual market. Your response to them is, we don't care. We care. And we're doing our best to deal with this. This is like going by a car accident where somebody's seriously injured, and rather than stopping and rendering aid, just driving on by. That's what our colleagues on the other side are doing. They're turning a blind eye, driving right on by a seriously injured person in a car accident. We are coming to the rescue of the people, the millions of people who are being hurt by Obamacare today. We would love to have our Democratic friends join us and do something truly sustainable. But you have to remember, my friends, how this started. Democrats jammed Obamacare through on a party line vote, and Republicans weren't able to participate in that process. So what we are trying to do is we're trying to save the people who are currently being hurt and whose health care has become unaffordable. If you would like to join us in this process, we'd love to have you. But failing that, we're going to get it done, and you can just drive right by the car wreck.
Mr. President.
Minority Leader.
Here's the correct analogy. Yes, there's been an accident. Yes, someone needs help. someone who's not a doctor, not a physician, doesn't know how to help the patient. Our Republican friends go by the side of the road, but they don't know what to do. So the Democrats come by. We're doctors. We say we know how to fix this system. We know how to fix this patient. And the Republicans say, nope, don't come by. Don't help us. We'll drive right by. And now the patient is ailing. But I asked my colleague, let's forget the past for the moment, because we got a much better argument than you. We had hundreds of amendments offered by Republicans that became part of our bill. I doubt there'll be a single Democratic amendment that will be. We had hours of hearings, hours of debates. You didn't. So you may not have thought the process was perfect. It's a lot more open than yours. But I have a proposal to my friend. Let us forget this draft bill. Let us right now, Democrats and Republicans, sit down and try to come up with a bipartisan bill. We're willing to do it today, now, this minute. Will you accept that offer?
Mr. President.
Senate will be in order.
Mr. President, if I thought that was a sincere offer, I would take it in a minute, in a New York minute. But it's not.
Senate will be in order.
The fact of the matter is that insurance companies are having to go to the state regulators as we speak to get insurance rates approved for 2018. That's the urgency that we are experiencing here. And then unless we act in an expedited fashion here very soon, we're going to see millions of people have their insurance rates raised by another double digits. It's been 105% since 2013. 105%. Obamacare was sold under the premise that families of four would see a reduction of $2,500. If you liked your policy, you can keep your policy. If you like your doctor, you can keep your doctor. All of that's false. False. This is a failed experiment. They may not be willing to help, but we will. And we will get it done and help the American people who are being hurt by the failure of Obamacare today.
Senator from Oregon.
Mr. President, I'm struck by this conversation as the ranking Democrat on the Senate Finance Committee. My colleague, the distinguished senator from Texas, is on the Finance Committee. He knows that I know something about writing bipartisan health reform bills. I've written them. They've become law. I can tell my colleagues I have not once been asked to be part of any bipartisan effort with respect to this legislation. And I think, colleagues, it's real clear what is going on here. Senate Republicans are going to keep telling Americans they're fixing their health care right up until the second it gets taken away. Now, as the ranking member of the Finance Committee, I find it bizarre that a health bill of this importance was hidden for so long behind closed doors, denying the American people the opportunity to see it together in an open debate. There have been no hearings on this dangerous, destructive proposal. Not one hearing on whether Medicaid should be slashed to pay for tax cuts for the fortunate few. Not one hearing on whether the bedrock protections for those with pre-existing conditions ought to be shattered. Not one hearing on whether Americans should face higher costs along with annual and lifetime limits on insurance coverage. This secretive process of concealing and rushing this bill, which until today had been seen by nobody outside of the Republican leadership and their lobbyist allies who dwell on K Street, the secretive process stands in sharp contrast to the process that led to the Affordable Care Act. So I put forward now a parliamentary inquiry. Is the chair able to confirm that the Committee on Finance considered S. 1796, the America's Health Future Act, which was ultimately incorporated into H. 3590, the Patient Protection and Affordable Care Act, in executive session on 8 separate calendar days prior to reporting the bill favorably?
The Secretary of the Senate's office through the Senate Library confirms that.
I have information that indicates that 135 amendments were considered in committee and that of those 14 amendments offered by Republican members of the committee or offered in a bipartisan manner were adopted during the consideration of S. 1796. Is the chair able to confirm that?
Secretary of the Senate's office through the Senate Library confirms that.
Therefore, Mr. President, I ask unanimous consent that no motion to proceed to calendar number 120, H.R. 1628, be in order until the bill has been the subject of executive session meetings in the Committee on Finance and the Committee on Health, Education, Labor, and Pensions, during which amendments from the majority and the minority received votes, and the bill has been favorably reported from those committees.
Is there objection?
Mr. President,
Majority Whip.
reserving the right to object. Mr. President, our colleagues are coming here today and saying they want to participate in the process to fix what's broken in the Affordable Care Act. Yet I have in my hand a newspaper article about a letter that the Democratic leader and his colleagues sent saying they refuse to participate in the process unless we drop all of our plans to repeal and replace Obamacare. So they refuse to participate in the process. And I would just point out, Mr. President, that the failures of Obamacare didn't just start today. It's been failing over 7 years, and they did nothing. Nothing. Nothing to help the millions of people who are being hurt, who had to move from full-time work to part-time work because their employer didn't want to pay the employer penalty for not providing Obamacare coverage. We know that many people have been hurt by it, and not the least of which are the people who are finding their premiums skyrocketing. They will do so again next year unless we come to their rescue. They've seen their deductibles so high they've effectively been denied the value of their insurance. I had a conversation just a couple of days ago, I won't name with the Democratic senator because it was done in confidence, who confided to me that his own son had effectively seen his premiums go up so high that it cost roughly $12,500 out of pocket to deal with his premiums and to his deductible and to pay his premiums. $12,500. That's not affordable to anybody, certainly in the middle class. And so I would object.
Objection is heard.
Mr. President.
Senator from Michigan.
Thank you very much. Well, first of all, I want to indicate before the distinguished majority whip leaves that what is being talked about here is like having a hole in the roof of your house. Instead of patching it, they want to burn down the house. So what we are not willing to participate in is burning down the house. We are more than happy, and in fact have proposals and are anxious to work with the majority to improve health care, not rip it apart, not take tens of millions of people's health care away, but improve it. And before asking a question of the majority whip, I also want to indicate for all those listening, we have the bill. We can actually read pretty quickly. It has been out. And even though it's considered a discussion draft, or we don't know what it is at this point, we have it. We are analyzing it. What our leader, the Democratic leader, indicated is what we have been able to read in this discussion draft, which is not only more of the same, but is worse for seniors, those in nursing homes, for children in Michigan and across the country. That's what's in this, which we now have, whatever it is called. So I would ask the majority whip, instead of burning down the house at this point in terms of ripping apart the healthcare system, would you join with us in putting forward a bill that would allow Medicare to negotiate prescription drug prices for seniors, which my hospitals and insurance companies tell me are one of the driving forces that are raising the cost of health care? Would you be willing to work with us on a bill to lower prescription drug prices and allow Medicare to negotiate drug prices on behalf of America's seniors?
Mr. President.
Majority whip.
Mr. President, I would say to the senator from Michigan that we'd be happy to work with you on high drug prices. That's a serious problem and one of the primary cost drivers of health care costs today. But this bill doesn't touch Medicare at all. And so we leave intact the health care for seniors, and it's not touched by this at all. But when the time comes for us to deal with Medicare, I think that's a debate we should have, and we would welcome.
Mr. President, to the distinguished leader, I would just simply say I'm proposing that instead of this, which is essentially burning down the house in America in terms of health care, that you instead join with us. And what you've admitted is one of the top drivers of health care costs in this country, which is what we want to tackle, Mr. President. We want to bring down the costs. We want to bring down the cost of prescription drugs, out-of-pocket costs for everyone whose copays and premiums are too high. That we want to do, taking away nursing home care, taking away the ability for a parent to take their child to the doctor, or someone with cancer to get the treatment they need, or a small business owner to be blocked from getting health care because of a pre-existing condition. We consider that burning down the house. We are opposed to that. Frankly, we'd love to have a ceremony and light this on fire, and then come back together and then work together on the number one driver, which is the cost of prescription drugs.
Mr. President.
Majority Whip.
Mr. President, maybe I misunderstood the question initially. I would suggest to the senator from Michigan that it is the Democrats under Obamacare who burned down the House, because the individual market for health care has been decimated. And we are coming to the rescue of those millions of people who don't have employer-provided insurance. They don't get their coverage under Medicare or any other government program. They get it from the individual market. You're talking about individuals and small businesses. Right now, people have almost no choices in many parts of the country, and those who have choices simply don't have it. It's simply unaffordable. So it's really an important conversation to have on drug prices and Medicare, and happy to do that. That would do nothing, zero, nada, to help the people who are hurting now as a result of the failures of Obamacare, and that's who we're determined to help by passing this legislation after an open amendment process and fulsome debate.
Mr. President, just in conclusion, I'd like to make one other comment, and that is for the people in Michigan who are purchasing on the private exchange, over half of which are able to get a policy today for their families for less than $100. I would say they would have a different perspective. We need to fix those things that are not working. But for the 97% of the children in Michigan who can now see a doctor because what has been done, for the hospitals who now seeing 50% fewer people walking into the emergency room without insurance, that are raising the cost for all policies, for the savings that the state of Michigan is going to have in its budget next year of $432 million in savings to taxpayers because they did the right thing by allowing children to go to a doctor instead of getting sick and going to the emergency room. I would suggest this is the wrong direction. Thank you.